Hi, welcome to You Didn't Get the Memo. I'm your host, Gloria Bailey Ray, and as always, we got a fantastic show for you guys today. I want to remind all of you that You Didn't Get the Memo is really and truly about providing you, the viewer, with relevant, factual, mainstream information to help you be informed and to make informed decisions. Now, if you have questions or you have comments, you can put them in the comment section, and we will do our very best to get to every single question or comment. All right. Now, let me share with you some disturbing statistics. With the aging population in the coming decades, is actually estimated about 1.2 billion women. Did you hear it? Billion women worldwide will be menopausal or postmenopausal by the year 2030. Y'all, that's not very far away. And some of you may know or maybe going through or can remember some of those common symptoms would be hot flashes, night sweat, sleep disturbances, vaginal dryness. And you know what? It's estimated roughly that about 85% of postmenopausal women have experienced one or some or all of these symptoms. Now, listen, the prevalence of these symptoms is estimated at approximately about 40 to 50 million women in the United States alone. Huh. Think about that for a moment. Now, current therapies targeted to treat a variety of menopausal symptoms are hormone based. These therapies are generally more effective than non hormonal treatments, which generally treat a single symptom. So today, you guys, we have with us Dr. Jennifer Henry, who is a naturopathic doctor. That's right, naturopathic doctor. Get that right. And she's going to talk about these things and a little bit of everything else and in between, but also treatments and things that are available to you. So let me tell you a little bit about Dr. Henry. First of all, she's a licensed naturopathic doctor specializing in women's health and hormones. She's one of the naturopathic doctors on the medical team at the Women's Vitality Center in Berkeley, California, where she sees patients in person as well as virtually. Y'all know we still got Corona going on, right? So, with that, Dr. Henry actually graduated from Dartmouth College. She has had a long career in public education before being inspired to go to naturopathic medical school in her 30s. And we're going to talk about, get her backstory. She enrolled in Bastrop University in San Diego, and during her studies, she became fascinated with hormones and hormonal health. Now, listen, Dr. Henry, we all know what it's like. You go to the doctor and they come in and they say, "How you doing?" And they're gone in 60 seconds, right? She actually takes the time to listen to her patients, their entire story, their unique experience, their symptoms, the life history, the current struggles and stresses that they may be dealing with. And she uses conventional and functional medicine lab testing to get to a diagnosis. Then she creates an individualized healing plan that's based in science. I love that. And rooted in the long and successful tradition of natural medicine. Now, me being from the South, I'm very much into that. That was what my grandmothers and my mom and how we were raised, natural medicine. Her approach emphasizes nutrition, botanical medicine, and lifestyle as the foundation of well being. So, without further ado, let me introduce to you Dr. Jennifer Henry. Dr. Henry, thank you so much for joining us today.
Oh, boy, I'm so excited to be here, Gloria. Thank you so much for having me.
Oh man, I know that we're going to have a great time, a great discussion. Because even before we went live, I'm like, oh yeah, we got to remember that. We got to talk about that. So before we jump into everything, let's just start with what your backstory is. I told the viewers a little bit. I read your bio, but really and truly, what was it that made you want to become a naturopathic doctor?
Yes, I'd love to tell the story. Honestly, it was actually hormones that got me was my first introduction to naturopathic medicine because I was in my late 20s and I was having these horribly painful periods. I would be at work under my desk, just doubled over in pain. I had so much stomach pain. I had acne. I had all these issues. And I went to the doctor, my regular OB at Kaiser, and basically all that she could do was offer me the pill. And I really felt misunderstood. I really felt that was an inadequate response because I wanted to know why this was happening and why it was happening all of a sudden and what I could do to fix it that didn't involve taking a drug. So I wanted someone to really help me figure this out. And conventional medicine has so many benefits, but in dealing with certain things, you really need more time with the patient, and you really need someone who's willing to dig into the cause of your symptoms. And so that's when I went to see my first naturopathic doctor. And she sat down with me for 2 whole hours. We had a long talk. She helped me understand where this was coming from, the connection between my digestive health and my hormonal health, and she got me completely back on track. So that was my first sort of personal experience, and I was working at the time and had this great career in education. And one day I just said, I just really like this. Like, I love the science part of it. I love the nutrition part of it. And I just took a leap of faith and decided to go to ND school.
Yeah, awesome. And, I'm certain there are a lot of women who are watching, and I want to give a shout out to all of you guys because Atlanta is usually in the house, Tennessee, Arkansas, Mississippi. I love it. And I want to give a shout out to all those ladies. And I know that there are women that are watching that can relate to that. And you're absolutely right. That seemed to have been the thing to do, the go-to is to put a woman on birth control. And many women had so many side effects from taking the pill, and it still didn't help the symptoms that they were having, and that's what they wanted treated. And in many cases, I know my case, being on the pill, it just caused, for me, more bleeding. Mm-hmm. So there are all these things that, to hear you say, and that's why I thought it was just great that we talk about that and we get it out there. Yeah. So thank you for sharing that. So let's just start with, what is a naturopathic doctor? And I can probably, ask that you encapsulate that with the type of training that you go through and licensings and things of that nature as well.
Great. Yeah. So naturopathic doctors, or NDs, N as in Nancy, we graduate from a 4-year graduate medical program, which is offered by 8 different universities in North America. We're trained in Western medicine, so we study anatomy and physiology and biochemistry and all the same body systems the same way that conventional MDs do. And in fact, I had a friend who was going to Georgetown medical school a couple years before I started naturopathic medical school, and our syllabi and all of our textbooks were exactly the same. She just sent me her textbooks, which was very helpful. So the difference is that we learn about all the body systems from a natural and holistic perspective. We're looking at how all the systems fit together and work together. And we're really trying to understand what's happening underneath. So we really learn a lot about the pathophysiology of things. And then we're trained to support those systems with nutrition, herbal medicine, lifestyle counseling, and pharmaceutical drugs. We do learn the drugs too, but we really save the drugs for the last resort. So we're really trying to address the imbalance first and figure out the why and not just the what before we resort to using drugs to suppress the symptoms.
Okay, awesome. And so for people who are wondering, ND, like I love you say Nancy, as in D doctor, that's naturopathic right. Doctor, right? So when we talk about being a naturopathic doctor, what types of patients do you treat? Are there different? Is there kind of certain specific patient that you're treating or not? Tell us a little bit about that.
Yeah, well, in my clinic at the Women's Vitality Center, we specialize in women's health and hormones. So we work with a lot of women in their 30s through 60s dealing with issues around fatigue, sleep, mood, weight gain, brain fog, period problems, perimenopause, and menopause. But NDs in general can focus on all different areas of health, from primary care, pediatrics, digestive disorders, autoimmunity, heart health, diabetes, even cancer care. So anybody really who's looking for some support that's outside of the conventional model can come see a naturopathic doctor. Some states, we're licensed in 16 states right now. So some states are naturopaths are covered by insurance. Some states are not. Unfortunately, in California, we're not currently covered by insurance. But we see all kinds of patients, and anybody can get benefit from seeing a naturopathic doctor.
Yeah. So do you work in collaboration? Let's just say that there's somebody who has been, you mentioned Kaiser, and I know that there are other healthcare systems that are out there, but let's just say that patients are being seen within these organizations, or even, in a private practice. Mm-hmm. Do you work in collaboration with those doctors? Mm-hmm. Because sometimes patients say, hey, I would like it if you reach out to my primary care, and maybe you guys can come up with a plan. So do you collaborate with other MDs?
Yeah, well, we certainly like to. So we're usually, in California, we're licensed as primary care doctors, and in general, a lot of naturopaths are separate. They're working in their own private clinics, and not affiliated with the hospital system. But still, we're sending letters, we're trying to collaborate with MDs as much as we can. Sometimes, that doesn't work as well as we want, because MDs are very, very focused on their modalities. But we always do our best, and we also work with physical therapists and nutritionists, acupuncturists, all kinds of different practitioners we're in communication with.
Yeah. Okay. Awesome. That's really good to know. Now, before we get into talking about hormones and all of that, we're going to take a quick break. And when we come back, I want to ask you to talk about hormones, where they come from, talk about the estrogen, progesterone, and their role in the body. Okay? All right. We'll be right back.
It's all of our responsibility to slow the spread of the coronavirus. So follow guidance from authorities where you live and stay home unless absolutely necessary. You can still use your outdoor spaces like yards and decks. It's also okay to go for a walk or exercise outside. Wear a cloth face covering, stay at least 6 feet away from other people, try not to touch any surfaces, and wash your hands for at least 20 seconds as often as possible. Visit coronavirus.gov for the latest information.
Because the fight isn't over yet.
You will see me choose to protect my community by wearing a face cover.
And even with my face covered,
you will see me.
As a son.
As a man with a never quit attitude.
As a fighter for change.
Join me in wearing a face cover.
To help stop the spread of the coronavirus.
Because this is one small act of kindness
that has the power to make a big difference.
All right. If you're just joining us, you are tuned in to You Didn't Get the Memo with my special guest, Dr. Jennifer Henry, who is a naturopathic doctor. And before we went to break, I had asked Dr. Henry when we return to let's jump right in and let's talk about hormones, and in particular where they come from and what's their role in the body. So, Dr. Henry, I'm going to punt that ball to you and ask that you answer that question. And, let's take it from there, okay?
Yes, it's a great question. So hormones are tiny chemical messengers that carry information from one place in our body to another. We have thousands and thousands of receptor sites in our bodies for hormones. So they really affect everything from our brains to our feet. They have a huge impact on how we feel and even kind of our sense of ourselves. So that's why they're so important to women's health and how women feel, especially when their hormones aren't right. We can really tell. There are many, many hormones in the body, but just to focus on the sex hormones, there's estrogen and progesterone. And they come from the ovaries and to a lesser extent, the adrenal glands. People don't talk very much about the adrenal glands, but that's a big focus of our practice, because the adrenal glands are these two little mounds of tissue that sit on top of the kidneys, and they're really important to managing hormones in general. Estrogen can also be produced in the fat cells. So just from a basic female physiology sense, Estrogen is your builder hormone. We like to say it's your juicy hormone. It rebuilds the uterine lining every month. Estrogen also plays a role in bone health. It keeps your bones strong. Blood vessel integrity, mood, skin, cognitive function, joint health, temperature regulation. So it really has these far-reaching roles. Progesterone, on the other hand, is the stabilizer. So estrogen is the builder and progesterone is the stabilizer. So it holds a uterine lining in place. It holds a potential pregnancy. It's calming. It helps calm the body, and it supports good sleep. It's anti-anxiety. And so they play these really vast roles throughout the body, and that's why when they're out of balance, women can feel so badly.
You talk about out of balance. I'm like, yeah, can we talk about that? I like the way you talk about progesterone. It's the juicy hormone.
Estrogen,
the juicy hormone. I've never heard that. So I'm like, oh, okay. So when a woman, estrogen levels are low, she needs to have it kicked up a little bit, right?
Right.
So
it really can affect you. It'll affect your skin. It affects your vaginal health. It affects your hair. So yes, this is the one that keeps things plump and juicy. And
okay.
when it starts to go low, you can really tell.
Yeah, absolutely. Well, let me just ask you this, Dr. Henry. When we talk about perimenopause versus menopause, so first of all, let's just start with perimenopause. Is there a specific age that people may become perimenopausal? And, what is perimenopause? What can a woman expect if she's perimenopausal?
Yeah. Great question. And people, again, this is just a topic that is just not discussed enough. And so all of a sudden, you'll be in your mid 40s and you'll be like, why can't I sleep right now? And why doesn't my exercise, in my diet result in the same outcome that it did 5 years ago? And so perimenopause is this period of time, 5 or 10 years, usually starting in your 40s or early 50s, where you're transitioning to menopause, where your ovaries are just no longer doing their monthly thing like they normally do. It's a really topsy-turvy time because as your hormones don't behave the way they're supposed to, there's a message to the brain to do more, to send more messengers to the ovaries to do their job. So it's like they're kind of like not aligned. And this is when you'll be bleeding heavily, you're missing your period, you'll have all these mood swings, you might have night sweats, you might have hot flashes, heavy bleeding, all kinds of things can happen during this time, and it's kind of like what just happened? It's a surprise for many people, and it's very overwhelming. And this can last for 1 year, this can last for 10 years or longer. And it's really not until you haven't had a period for 1 whole year that you're considered menopausal. And then that journey is done and you won't be getting a period going forward most times. And so we kind of talk about perimenopause as puberty in reverse. Because you're, instead of all your hormones building up, they're all kind of coming down, but it's a very rocky journey.
You can say that again. For sure. And, when we think about the symptoms that women have, now, I don't know if you've seen, patients, probably so, I would imagine so, but also, what about women that are perimenopausal, but they're going through, I find that some women are going through this phase of depression or, these mood swings, or like they're in some kind of brain fog, like I just can't think clear. Do you see that? What are your thoughts about that?
Yeah, absolutely. No, the estrogen and progesterone, there's receptors in the brain for estrogen and progesterone. And especially when your hormones are going like this, and typically that's estrogen is kind of going up and down at that time, you're going to see mood swings. It's kind of like you're having the worst PMS, but it's not just for a couple days, it's forever. It's all day, every day. You're going to have some brain fog. You're going to have maybe some anger or rage or depression or irritation. And these are all the things that when we support you, not just with hormones, sometimes just with hormones, but with your lifestyle and your diet and your exercise, all these things can help to stabilize you so that your estrogen isn't kind of doing these ups and downs and causing all these symptoms.
Yeah.
So we work with that and try to get things kind of back and balanced and help ease that transition until you're feeling stable.
Yeah, we have a question from one of the viewers. They want to know, do hormones affect senior women? And I'm not quite certain what is, the classification for seniors, if it's 55 or 65, but what would you say to that?
Yeah, so depending on how far away you are from your last period, how far away you are from menopause, hormones do play a really important role post-menopausally because they protect our bones, our cardiovascular system, our brains, our skin, and our vaginal and vulvar health. And so you can take hormones past menopause. It's better. We prefer to treat people closer to menopause and then kind of slowly carry them down until they don't have any more symptoms. But we do also treat people who've been postmenopausal for a long time. So I hope that answers the question. We don't necessarily want people to be on hormones for the whole rest of their lives. But we have to remember that we have evolved as humans, and our lifespan is much longer than it used to be. Hundreds of years ago, women were passing away at 50 and 60, and now they're living many, many decades beyond that. And those hormones still provide a really important protective role for our health. And so it's always going to depend on the person, their particular story, and their symptoms. And that's what we're going to base it on.
Yeah. Okay. Let me go back to another symptom that I hear a lot about, and you and I kind of got into this prior to going live, and it's also about a woman who is still sexually active or would like to be, but she has vaginal dryness, she has pain in having sex. And this was one where I said, men, you all need to be tuned in and listening to this, because there's some validity to, there's validity to what is happening. So can you talk a little bit about women who come to you that are experiencing or having these particular symptoms?
Absolutely. So, libido is a huge one. It can go down with lower estrogen or lower progesterone and lower testosterone too. And we might use any of those three to help treat low libido. And then vaginal dryness and vaginal pain. We usually help treat that with estrogens or DHEA, which is another androgenic hormone, or testosterone. And all of those can help bring that vitality back to that tissue and bring the blood flow back and have that tissue being nice and healthy and pink and supple and pliant, so that you don't have pain, and also getting you to make those vaginal lubricants that are, drying up, as they say, during this time. And so this is absolutely a physiological impact of those hormones. And we want to bring some vitality back to that tissue with replacing the hormones that have been lost. And it is not a death sentence, this perimenopause. You can get your life back. You can have a vibrant sex life during perimenopause and postmenopausally. We have tons of patients who are still having sex into their 70s and 80s and more. And so we want to provide that support and hope to people that this is not like they're not just bound to have painful sex or no sex anymore, and you can get that excitement back.
Yeah. And it's interesting. I was listening to a radio show, and one of the callers called in, and she said she was 75 or 76. And she said, I'm having the best sex of my life. Is there something wrong with me? And I just know that the hosts, they were like, well, let me get to be your age and, hope that's the case. Yeah. And these are the things that women need to know, that they can actually have a life and a healthy sex life. And it's not about, I'm past menopause and, so what else is there? We sleep in separate rooms, and, there's no intimacy there. And I think that probably there are a lot of people who have suffered through this and just didn't know that there was treatment out there available for them.
That's right.
So I just hope that if you guys are tuned in, that you are really feeling this. And like I said, I want to remind you, you have more questions, put them in the comments section. Dr. Henry, we're going to take another quick break. But when we come back, I want you to talk about, the hormone replacement and those common uses, because we talked about some of those, but, what are the signs that you need hormone replacement? So when we come back, let's discuss that. And you guys don't go anywhere.
Before we celebrate the freedom most Americans have, we must fight for the freedom all Americans deserve. Because all lives can't matter until Black lives matter.
Because the fight isn't over yet.
You will see me choose to protect my community by wearing a face cover.
And even with my face covered,
You will see me.
As a son,
As a man with a never quit attitude.
as a fighter for change.
join me in wearing a face cover.
To help stop the spread of the coronavirus.
Because this is one small act of kindness
That has the power to make a big difference.
All right. Hey, guys, if you're just tuning in, you are watching You Didn't Get the Memo with your host, Gloria Bailey Ray. And my dope guest is Dr. Jennifer Henry from the Women's Vitality Center. And before we went to break, I asked Dr. Henry a question to talk about the signs. What are the signs that you would need hormone replacement therapy? So, Dr. Henry, you there?
Yes, I'm here.
All right. So, take it away.
Some of these, but some of the things that people experience sort of perimenopausally are insomnia, new onset sort of irritation and anger, depression, mood swings, like you're weepy and you're crying at a commercial, brain fog, you just can't, you don't remember where your keys are and you just can't think the way you used to, hot flashes, night sweats, irregular cycles, heavy bleeding, vaginal dryness and painful sex. We talked about low libido, weight gain despite the same diet and exercise, and migraines. These are all some of the things that kind of happen perimenopausally. And hormone replacement therapy is often people think of it as just giving estrogen postmenopausally, but it can involve all the different hormones and can be given at different times in life for a variety of reasons. So anytime there's a hormone imbalance and there's symptoms, we might consider hormone replacement therapy. So premenopausally, if a person has ovarian insufficiency, PCOS, endometriosis, PMS, estrogen dominance, chronic UTIs, cyclical migraines, these are all reasons why we might give someone hormones even before they're perimenopausal. And then during perimenopause, we're really trying to balance things out, all those symptoms that I described, until we get to a place where you're not having those symptoms anymore. Postmenopausally, we're running to just kind of stabilize and protect the tissue. So that's where we're getting the cardiovascular benefits, the help for our brain and our skin and our vulvar health. And we kind of use the minimum dose that's required to keep you stable. If someone's, for example, postmenopausally having osteoporosis, we might treat with estrogen and testosterone to support the bone tissue. There's many different kinds of hormone replacement therapy. As an ND, I primarily focus on bioidentical hormone therapy. So what that means is we use the exact same chemical structure as the body makes. So the body recognizes it and knows how to use it. When hormones bind to a receptor site, it's like a key going into a lock. And when the hormone is bioidentical, it's like the exact key. So it really works better in the body. And when it comes to the body processing the hormones, in order to keep the hormones balanced and safe, we want your detox pathways and stuff to know how to break it down. And they're going to know how to break it down if it's natural or if it's a bioidentical, because it has the same structure as the same molecule in your body that your body makes. So it has a better chance of taking care of those hormones sort of efficiently and safely. There are other types of hormones that aren't bioidentical, such as Premarin, oral progestins, and oral contraceptives. We were talking about the pill earlier. These are the more conventionally used therapies, and for better or for worse, and what a lot of the studies are based on. And they have a little bit of a different safety profile, but sometimes they can be used effectively too.
So when we think about hormone replacement therapy, back in the day, women only lived to be 50 years of age, 50, 60 years of age. And it's amazing how medicine and, just in terms of our bodies, how things have evolved. So for women who are watching this and they're saying, wow, hey, because I just think about women who have passed on and they were really, really young, but a lot of these symptoms that you're talking about, they just suffered through and dealt with it. And I just think that that's such a tragedy.
It really is a tragedy. And I have to say, it was kind of probably women in their 70s now, 70s, 80s, who got to do some of the hormone therapy that came out back in the 30 years ago, 40 years ago. So people were getting treated by hormones. And then there was this big study called the Women's Health Initiative. It started in 1991 and continued until 2000. And since that study, hormones got a really bad rap.
Yeah.
And, what happened was that researchers found that women taking these combinations of oral estrogen and oral progestins, and I'm saying progestins because that's not bioidentical progesterone, had an increased risk of certain diseases. And the data really freaked out doctors and patients alike. And the hormone therapy just came to a screeching halt. And however, in the follow-up analyses from the Women's Health Initiative, researchers are to this day declaring that actually it was just the synthetic progestins that was linked to higher rates of breast cancer and heart disease and different negative outcomes. And this is why we only ever recommend bioidentical progesterone when we give our hormone therapies. But the media response to the WHI was just so overwhelmingly negative, and without diving into the data. And so many women, just decades of women have been suffering since because of this. Hormone therapy now sort of making a resurgence, but it was really, I have to say, if it was men, they wouldn't have shut it down. Okay, really don't think they would have, because the level of degree of suffering, the way it changes people's lives, it's just totally unacceptable for women to be having this, and to be just saying, well, this is just life. It's like, no, it doesn't have to be this way. Right. And really safe ways of helping people. So we always, of course, have to look at women's risk factors and their symptoms, and we're always looking for the safest way to do things. But we do need to expand around this and get women the help they need.
Yeah, it's interesting that, a lot of things, if it were happening to men, we know that would be resolved, that it wouldn't even be an issue. And you talk about the safety, is hormone replacement therapy safe? And you're absolutely right. All of the data, and people just kind of looked at it and said, oh, and even to this day, I know that there's still physicians who are just saying, no way. And you just can't tell a patient just to live with that and live with these symptoms, because if what may be mild to me is not mild to you. Right. Or this, vice versa. If I'm saying that I'm having major insomnia, and you mentioned just looking at a commercial and I'm weeping, that's not normal. That is really not normal. And I just want us to underscore that to women who are watching. Guys, you've got to also take control of your health care, your self-care. You have got to demand, wait a minute, is there something else? And I know we'll talk again at the end, but also, Dr. Henry, I know that there are other naturopathic doctors around the country, and you just have to look up and find out where these naturopathic doctors are and be willing to go see them. And I'm just going to say this. I know that there are states, like you said, that will not, where insurance will cover it. And there, in the case, I always say, what is your health worth to you? And the reality of it is, you know what? Whatever it takes for me to feel better and get better, guess what? That's what I'm going to do, because it's called self-care. I can't care and take care of somebody else if I'm not even taking care of myself. So when we talk about, the risks that are associated with it, I think that how you encapsulate and talk about it, you've got a great handle and grasp on it. And I hope that, that people watching this really and truly get this. In fact, we've got a couple of questions from our viewers. From a naturopathic perspective, what recommendations do you have for irregular sleep patterns and lack of sleep as opposed to taking a medication? That's the first one.
Okay, that's a great question. And it's just so prevalent and common in society nowadays for multiple reasons. So the first thing that's really important is having a regular early bedtime and a regular wake time. The body is, we're animals and we're diurnal. So just like the birds wake up at the same time every morning, our bodies want to be on a schedule. And the best sleep is the sleep that's before midnight. So I'd like to tell patients, try to go to bed around 9 or 10 and make sure that you're not on your screen before you go to bed, that you're not having a bunch of food before you go to bed. And we call that sleep hygiene. Just make sure that you're doing the things to calm yourself down and then go to sleep. Progesterone is a really common, helpful hormone for treating insomnia. And so that's something that you could talk to your practitioner about. Other reasons why insomnia happens. One is stress and the way that stress affects the body, specifically the adrenal glands. So reducing stress and calming yourself before bed and making sure that you have the energy to do all of your stuff during the day so that you don't, your body's not trying to do those things at night. So we'd like to see cortisol, which is your adrenal hormone, going up during the day and then coming down to a low at night, and then your melatonin coming and taking over and being high all night, and the melatonin being that sleep hormone. And some people take melatonin. I'm not giving medical advice today, but that's something to consider or talk to your practitioner about. Blood sugar is also a really important thing to consider for sleep disturbances, and making sure that you're having really stable blood sugar throughout the day. So you're not eating some sweet snacks before bed, you're not having a big dessert for your snack, but you're having protein and fat and fiber at each one of your meals, and having the steady blood sugar throughout the day will really help you to not wake up with a blood sugar spike or a blood sugar low in the middle of the night. So those are kind of our some of the basic things that we tell people to consider.
Okay, excellent. The next question from a viewer is, what do you suggest to take in place of hormonal supplements, especially if a physician is saying not to take it because you are a high risk for cancer reoccurring?
Okay, yeah, that's a really good question. And if you are high risk for cancer reoccurring, we don't, especially a hormonal sensitive cancer, then we don't want to put you on any hormones that are going to have any systemic effects. So instead, we would treat you with other things. So depending on what the symptoms are, we might give you herbs, which are going to have a different interaction with their hormone receptors, but that are not hormones. And so sometimes herbs can be really beneficial in supporting people's hormonal symptoms. And we do that for some people who are ready to just jump into hormones, or we don't think that they need to jump into hormones. We'll give them herbs. We'll give them nutrition. We're going to really help to stabilize people's adrenal glands and their stress response, because that really is the foundation for all of this. And so there's definitely things that you can take, but you need to get advice from a licensed person who can specifically listen to your symptoms and match you up with the right supports. But there's definitely options out there, so it's not like you just have to give up. And then there's some times where you might take estriol, which is which is one of the forms of estrogen that has a really mild systemic effect. and really works specifically on the vaginal health. And so if one of your symptoms is vaginal dryness, maybe your practitioner would consider estriol instead of estradiol, which is the more common hormone therapy. So you just really have to find someone who can talk you through all those options and who's not just gonna say no and sorry,
Absolutely. Dr. Henry, you kind of led into this. It's a great question. The viewer, thank you for those questions, you guys. Who should avoid hormone replacement therapy? Because you kind of talked about that, but let's dig a little deeper into that.
Yeah.
Talk about that.
That's a great question. So women who don't need it, they're feeling great, their symptoms are fine, their screening tests for things like bone health and cardiovascular risk are all good. And they're just like, they just sailed through perimenopause and menopause and they're fine. So we wouldn't jump to hormones for those people. People with a history of heart attack, blood clots or stroke, they really should not take oral estrogens and should avoid also progestins, which are the synthetic progesterones. People with severe depression should not take oral progesterone or progestins because that can increase depression in those people. I mentioned people with hormone-sensitive cancers. And just a note about cancer, hormones that are appropriately dosed don't cause a normal cell to turn into a cancerous cell. But if there is a cancer that's hormone sensitive, then you really would want to avoid hormones. And you also want to balance hormones to reduce your risk of cancer. And that means making sure that you have a good enough progesterone to support a high estrogen. If you have high estrogen, you want to bring that down and bring your estrogen or your progesterone up. We don't want people to have too high hormone levels, particularly estrogen. We regularly test people through any combination of blood or urine or saliva to make sure they're kind of in that just right range. Testing also helps us to know that their body's processing and detoxing their hormones. So we want to make sure that that's happening well and safely. And I mentioned this before, but we do give consideration to women who are 10 years post-menopause or above, because the studies show that hormone therapy is best tolerated and most safe the closer you are to menopause. So with those women, we go on a case-by-case basis and make sure your risk factors are low. And then just to, last and kind of most importantly, we don't rely on hormones to help people feel better. It all starts with a foundation of healthy nutrition, exercise, and sleep, healthy digestion, stress management, adrenal health. I mentioned blood sugar. All of these things I've had patients who I said, just take out sugar and take out alcohol for a week and tell me about your hot flashes and night sweats. And they'll come back and they say, Dr. Henry, I'm cured. And I love that, because then we don't have to go into the other modalities and kind of think of this as a pyramid. You need to start at the bottom and do these foundations. And if we need to, we'll do herbs or we'll do hormones. And so it's really important that we test and monitor so that we make sure that the hormone replacement is safe for people.
Yeah, absolutely. Now we're going to take another quick break, and when we come back, because February is Heart Month, I would like for us to discuss the relationship of hormone replacement therapy, or HRT, to heart disease. So don't go anywhere, you guys. Keep those questions coming. We really appreciate it, and we will be right back.
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill me.
I don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
Hi, if you are just tuning in, I'm telling you, you guys have missed a great discussion thus far. I have with me as my guest, Dr. Jennifer Henry, who is a naturopathic doctor, and we have been discussing really women's health all encompassing everything from menopause, perimenopause, hormone replacement therapy, and so on and so forth. And so, Dr. Henry, before we went to break, the question was, or the comment was, February is Heart Month, and I would like for you to discuss the relationship of hormone replacement therapy to heart disease.
Yes, absolutely. So it's a really good question. Heart disease is the #1 killer of women.
Yes.
And February is also Black History Month, and Black women have an even higher risk of heart disease, so it's really important to be talking about this.
Yes, absolutely.
So the research is suggesting that the decline in estrogen after menopause is a factor in the increase in heart disease in postmenopausal women. Estrogen is believed to support the inner lining of the artery walls, this part, let me see if you can see it, of the artery walls, and it keeps them flexible and supple, much like estrogen helps our skin, helps our vaginal tissue. And so when the artery walls become more rigid and less flexible, that's when you can get plaque buildup in the arteries, and that's when things like high blood pressure can start to cause problems with arteries. So studies have also shown that bioidentical progesterone, as opposed to the progestins used in a lot of the older hormone therapies and birth control, kind of talked about that, it can increase HDL, or your good cholesterol. And so we know that hormones play an important role in heart health. In fact, going back to that Women's Health Initiative study, when they looked at the people who just did estrogen, they found a decrease in breast cancer, a decrease in heart disease, a decrease in colorectal cancer, decrease in death. And the one thing that they did find was a decrease in clotting. And so that's why we don't do oral estrogens. We just do topical estrogens. And that they found that with topical estrogens, that increased clotting risk went away. So there's lots of reasons to continue to have these hormones in place and to support our heart health. However, if you have had, like I said, a stroke, coronary artery disease, that's something you need to be aware of. And just a little bit more about that oral estrogen, just to explain, oral estrogen goes through the liver first. It's called a first pass effect, and it influences the liver's production of clotting factors. So when you're using other forms of estrogen, or we're talking about the endogenous estrogen that your body makes, you don't have that huge hit on the liver in one go. And it's important to mention that because sometimes doctors recommend oral contraceptives as a form of hormone replacement therapy to help stop perimenopausal symptoms, kind of shuts everything down and stops that up and down. But in women over 35, oral contraceptives do increase risk of thromboembolism, clots, and stroke. So we don't support their use in perimenopause. But like I said, we do have this option of topical or vaginal estrogen, which does not increase the clot risk.
Yeah. Okay. Awesome. And in fact, one of the things I was just going to ask about the forms that hormone replacement therapy comes in, and if you could just kind of break that down a little bit more, because there's the synthetic progestins, and just talk about that, progesterone, testosterone, so on and so forth.
Yeah. Right. So estrogens, we usually use a combination of estradiol, which is E2, and estriol, which is E3. And like I said, we do that in a cream or a vaginal insert or a vaginal cream, a cream on your skin or to the vulva or inside the vagina. Progesterone, there's synthetic progestins like the ones you might get in a birth control pill. And then there's bioidentical progesterone. And that also can be applied to your skin. It can be applied vaginally, or the oral progesterone is safe to take. There's also testosterone, DHEA, adrenal and thyroid support. All of those can play an important role in balancing the whole hormonal picture. And often those are taken orally and sometimes also topically. So there's creams, like I said, topical to the skin. You might put that on your inner arms or your inner thighs. There's creams that you can apply to the vulva or the inside of the vagina. There's vaginal suppositories. There's patches, and you might have heard your doctor talking about an estradiol patch, which you would kind of put on your skin and change it out every twice a week or something like that. There's vaginal rings that they have now, which is like a ring that you insert to your cervix, and that gives out a low dose of hormones. The IUD inserted inside the uterus that only gives out progestins. And then we talked about oral estrogens. You can take those, and oral progesterones. We don't particularly recommend those, but they are available. And then pellets are a kind of a new technology where they insert the hormone kind of right under the skin. We don't use pellets in our practice, but other doctors may do that. And so if you're working with an ND or an integrative medicine doctor, we can compound the prescriptions and really tailor the delivery and the dose to each patient. And we can get really, really specific, like, okay, 0.35 is too much, but 0.30 is perfect. And we do that for patients because some patients are very, very sensitive to the amount that they're getting. And there are options with your conventional practitioner, specifically the estradiol patches and the prometrium. Those are available as standard prescriptions from an MD, and they should be familiar with those.
Mm-hmm. Oh, absolutely. So you're talking about they have a plethora of options in which this it can be delivered. So that's good. Now, here's my question for you, Dr. Henry. What do you want viewers who have been watching the show today, what do you want them to take away from today's show?
Yeah. Well, first, I just want to offer hope for people who are having any kinds of symptoms, and just to normalize that this is something that every woman is going to go through to some degree or another. And it's really not talked about enough. And it's not, the women's experience is not honored enough. So I just want to say, like, it's not you. And it's important that you have access to and are being supported by your practitioners. So to as you said, Gloria, just kind of take that into your own hands and demand getting the support that you need. Hormone replacement therapy, it really needs to be done with care, but it can be such a huge benefit for many women, both for their well-being during perimenopause and for maintaining health afterwards. And if you're not wanting to do hormone replacement therapy, that's okay too, because there are many layers and many ways to support your symptoms and your health for the long term. And we can't underestimate the power of a healthy diet and good sleep and exercise and fresh air and sunshine and all the things that we know to take care of ourselves. I wanted to tell people that we have more resources about this on our website. So the womensvitalitycenter.com is our website, and then we have 2 different workshops: bioidentical hormones, your questions answered, and the perimenopause 101. And that repeats a lot of the stuff that I said, but it also goes into more detail about perimenopause and how we can support you, not just us, but how different practitioners can support you in this journey.
Yeah, well, thank you so much. I really, really appreciate you have enlightened us, and I'm so grateful for your time. I want to say not only a very special thank you to Dr. Henry, but I'm just so grateful for all the information that she shared with us, because so many women have suffered, are suffering, will suffer, and not even realize that there is help out there. I want to remind you guys the next week to be sure and tune in with me. And my guest will be nutritionist Miss Michelle Dwyer, who is a health coach. And she is going to just bring it. We're going to talk about a lot of things, and that's really and truly what You Didn't Get the Memo is all about. It's about providing you, the viewer, with relevant, factual, mainstream information to help you be informed and to make informed decisions. Guys, it don't get no better than this. So I want to just remind all of you guys that if you didn't take anything away from today's show, then it really and truly is you who didn't get the memo. I'm Gloria Bailey Ray, your host. And until this time next week, I want you to be safe, be well, and remember that the quality of your life is determined by the decisions that you make. God bless.